All right, hi everyone. My name is Julie Boyle. I am an extension educator in the health and well-being area for Nebraska Extension. My colleague Brittany Speaker, she is also a health and well-being extension educator. And just to give a couple shout outs to those of you in the audience, Ann Fenton, Pamela Slaymaker, and Ashley Fenning are also a part of our Tai Chi team here in Nebraska, and they are joining us as well. So welcome to Tai Chi for Health. Today, we're going to talk a little bit about understand the history of Tai Chi. We're going to explore the benefits of regular practice and discuss some of the strategies that we've used to implement Tai Chi across the state of Nebraska and what barriers and solutions we've come up across. And then we will give a demonstration at the end. So the background of Tai Chi. It originated in ancient China over 500 years ago as a martial arts. Um, it has since evolved into an art form and is practiced around the world as an effective exercise for health. Tai Chi is an evidence-based practice that has been approved by the CDC and Area Agency on Aging as an effective fall prevention exercise. Anyone can learn and enjoy it, including children, people with a disability, older generations, as there's something for everyone. There are slower paced styles up to more vigorous movements. It's an easy, low-cost movement modality that's appropriate for any age and all physical abilities. So just looking at some statistics nationally, in the United States, almost 28% of those over 65 reported a fall in the last year, according to the CDC. And unfortunately, unintentional falls are the leading cause of injury and death in adults over 65. So when it comes to physical activity, the CDC shows that 1 in 4 people are inactive outside of work. And for adults over the age of 65, only 13.9% of them are meeting the federal physical activity guidelines for both aerobic and muscle strengthening activities. And that's reported from 2022. So Tai Chi fits into this well, and it helps our older generations get a little bit more active in an easy, accessible way. So on a more local level to Nebraska, 27.8% of Nebraskans aged 65 and older have reported falling in the last year. Additionally, 1 in 5 Nebraskans meet the federal activity guidelines, while only 26.8% of Nebraskans 65 and older meet the federal activity guidelines in the past 30 days. So bring in Tai Chi for Health. This is an evidence-based program that was developed by Dr. Paul Lamb. Dr. Lamb worked with colleagues in the medical field to adapt these programs for almost any chronic condition and disability, such as arthritis and fall prevention, osteoporosis, diabetes, memory care, heart health, just to name a few. To become a certified instructor, you register for the program that you want to teach, and then you have to complete a self-paced preparation course prior to attending an in-person or online workshop with a master trainer. So Brittany and I are both certified in Tai Chi for arthritis and fall prevention, as well as Tai Chi for health. Brittany has an additional certification in Tai Chi for arthritis and fall prevention seated. So that's an extra step that you have to take with the fall prevention piece. So implementation and barriers and strategies that we've used. Partnerships. Here's a list of partnerships that we've come across as we have tried to expand our program across the state of Nebraska. We've gone to our health departments and senior centers, our assisted living centers, libraries, local gyms, and exercise facilities. Local businesses and Area Agency on Aging has helped us. Additionally, mental health services, and then we've had some success with offering some remote virtual options through Zoom. The two programs that we offer in the state of Nebraska are Tai Chi for arthritis and fall prevention. This is the one that actually started us off in Nebraska with Ann Fenton. It has both standing and seated instruction using Sun style Tai Chi. Sun style has a higher stance with less kicking and punching. It's more of a slow, fluid movement. It is ideal for those who have limited balance and mobility and for those who need to stay seated for a variety of reasons. It still has full body engagement to build strength and balance with slow controlled movements. And additionally, it helps to improve circulation, posture, and joint mobility. It can enhance focus, relaxation, and breath control. Our next program that we offer in the state of Nebraska is Tai Chi for Energy, and this combines the Chen and Sun style Tai Chi. Chen style is dynamic movements that build strength, coordination, and internal energy. The Sun style is that smooth, flowing movement with agile stepping to promote healing and relaxation. So these styles complement each other to create a balanced practice that develops both strength and energy. This program is a safe, low impact, and accessible program that incorporates slightly quicker movements than the Tai Chi for arthritis and fall prevention, and a little bit lower stance. Now, Tai Chi is very accessible. We can adapt how low our stance is in any program. So it's suitable for a wide range of participants and fitness levels. Has the same benefits as the arthritis and fall prevention program with the addition of the increased energy and the ability to manage stress. So this Tai Chi for Energy is really trying to harness that energy and bring our stress levels down more. So some barriers and some solutions that we've faced as we've expanded our Tai Chi program across the state. Some of our senior centers are already utilizing different exercise programs. So suggesting that a rotation of activities happens in these facilities is something that's been successful for us. Recruiting participants. We need to use a variety of marketing strategies, newspaper ads, local websites, flyers, our local service organizations to help boost that recruitment piece. Some of us have limited space and instructor capacity, so adding additional classes or alternating facilities. Transportation and access to classes and locations. Again, rotating where programs are located and providing a Zoom option if available. And then varying participant abilities. The nice thing about Tai Chi is it can be adapted to almost any ability of our participants. Whether they needed a seated program or a standing program, we can use microphones and we can provide practice cards and handouts. And then maintaining attendance and long-term engagement. So we want to encourage buy-in with a registration fee, have participants set goals, and create safe and welcoming environments. Brittany is going to talk to you about some of the results that we've seen across the state of Nebraska.
Thank you, Julie. Let's go ahead and start with our our reach first. So we offer classes virtually and also in person. We started off doing exclusively in-person classes, and last fall we introduced virtual options via Zoom, just because we span a huge geographic area in Nebraska, and I know we're not the only state in that boat. And so this kind of opens up accessibility options for others that maybe can't physically get to a class weekly or twice a week. So we have hosted in-person classes across 11 counties so far in our state of Nebraska, and we've hosted 2 virtual options so far. And our total reach since we've brought this program in Nebraska is 233 participants across 29 classes so far and continuing to grow. So let's talk about some qualitative results. We have a plethora of qualitative results. We probably could have a success story from all 233 of our participants, but we can't go through all of those today. So we're going to pull out a couple that are highlights and or themes that we've seen so far in terms of success and improvements in our participants. So first and foremost, we've seen improved mobility. So one participant reported improved neck movement, allowing her to look to the side while driving. So this particular individual was not able to turn her head to even feel like she was able to safely drive. And by the end of Tai Chi, that had totally changed for her. We're also seeing reduced pain. So a participant shared they experienced just generally decreased pain, whether it's with a chronic condition or just general pain. We have better concentration. So, one participant noted improved focus. And one of my participants, in one of the first classes I ever did, she piped up and said, "Hey, I knew you were going to work my body, but I didn't know you were going to work my brain." And that is just probably one of my favorite quotes of all time because it does. It reaches different points of our health and well being. So, not only physical, but also mental. Stress management has also been a theme. So, one participant reported using Tai Chi breathing techniques at home during stressful situations. So, when we do our full programs, we're learning the Tai Chi basics, right? And then we're putting it all together. But we're finding that people are even taking pieces and the tools within there and applying it to different areas of their life. So, we have this breathing technique called Dantian breathing, and they're utilizing this breathing style to help kind of get through a stressful situation. We also have improved balance. So, one participant mentioned after a neurological illness, they were able to stand on one foot for 1 second. And that was a huge success for this individual. We also have a reduced fear of falling. So, after a fall at home, one participant reported stronger legs, greater confidence standing up independently. And we know that when we have more confidence in um, our balance and in our walking, that we do have less falls. We have safer people at home, all the things. And so we want to keep people in their homes as long as possible. And so we're really excited to continue to expand this for a lot of these reasons and many, many more. But let's talk a little bit more about some specific evaluation results. So we have been kind of transforming in terms of what our evaluation systems look like here in Nebraska for our Tai Chi for Health programs. And so we have started using a quality of life survey to really get at different points of health and wellness within our participants' lives. And so, since we've started using this, and we've exclusively used it on Tai Chi for Energy so far, but we're expanding into our other certifications. But so far, we've garnered information from 17 participants. And in that, we've seen 24%. Or 24% showed a decrease in pain, impacting their usual activities. 41% showed improvements in their physical and mental health, and 94% met their personal health goals. So, over the course of 10 to 16 weeks, they feel like they've made personal improvements. And again, I could pull out 233 success stories for how people are meeting those things. And it's so individualized, which is kind of the cool thing to garner those relationships and find out how this really truly is impacting their lives. So, next steps for Nebraska Extension, the Tai Chi for Health program. We want to expand our class offerings through the Tai Chi for Health Institute. As Julie mentioned, we do utilize Tai Chi for Health as kind of our base program by Dr. Paul Lamb. And there's a lot of different options we have to go down, but we're kind of looking at, the Tai Chi for Arthritis 2 set, maybe the Tai Chi for Energy 2 set. We're also interested in the Tai Chi for Dementia or the Tai Chi for Kids. I guess not dementia, but memory is maybe the more specific term there. So excuse me there. Tai Chi at work also may be a really applicable thing for our population that we're trying to serve. So we haven't quite solidified exactly how we want to see that kind of transform into the next offerings, but we are really excited because we have so much opportunity for growth there. Secondly, we want to continue to improve our evaluation methods and establish statewide evaluation systems. So like I said, we have already started utilizing this health-related quality of life pre and post survey. And it's really important that we're doing a pre and a post specifically because our our programs are over a long period of time. Like I said, a 10 to 16-week program. This is over the course of several months, and a lot can change in that amount of time. So we have that on a roll here, and we're hoping to have a lot of data by the end of 2026. We're also in the process of creating a 3 and 6 month follow-up evaluation. So, we can have really great results immediately following our programs, but the question is, are people continuing to use these tools, strategies, and programs in their free time? Are they choosing to utilize these things, and how is that impacting their life? And so we're excited to see what the data shows us there over the long run. And we have other ideas kind of spinning around in our brains as far as growth in this program in Nebraska. And we're really excited because there is so much opportunity to serve our communities here. All right. So next, we're going to do a little demonstration. I'm going to give you some background information on kind of what the program really looks like and what we focus on. And then I kind of want you to see what a set looks like. So let's talk about the principles of Tai Chi first. So first and foremost, we have movement control. So this is one of the basis of what we teach our Tai Chi participants. So, and actually, when I teach this class, I focus on principles almost exclusively for the first session, and because this is the foundational pieces of ensuring that we're getting the most out of our Tai Chi classes and we're doing it safely. So, movement control is a concept of using slow, smooth, continuous, gentle resistance. And with each of these principles, I like to do an activity that kind of drives home the lesson there. And so here sometimes we'll practice like wave your hands through sand. What does that feel like? Like imagine if you were moving your hands through sand, what would that feel like? Okay, let's do that and move through water. Okay, it's a little bit easier to move our hands through water, but there is some resistancy there versus, just move your hands through air. Like there's nothing holding them back. And, this is an opportunity for me to kind of reel people back and be like, hey, when we were in that area of water, that's the type of resistancy I want you to be using throughout the whole course, the whole program. And so we use activities like that to kind of really emphasize what we're talking about, because when we say slow, continuous movements, well, what does that mean? And so that's why we practice it. Second principle here is body structure. So we're really focusing on alignment and weight transference. So feet are super foundational to our Tai Chi safety, right? And feet are like the foundation of a house, right? We always want to make sure we have soft knees. We never want locked knees for lots of reasons. And then making sure the crown of our head is to the sky. And we notice that when we do some soft knees, bent knees, that sometimes we do get out of alignment. And so it takes some practice to kind of figure out what that looks like for individuals, because sometimes maybe we're leaning too far forward, maybe we're overcompensating and we're leaning backward, maybe we're tilting our head back. So it kind of takes time and practice to figure out what that alignment really looks like. Third principle of Tai Chi is internal components. So we have two subcomponents here. We have song, and this is the gentle loosening of our joints. So really expanding those joints out and thinking that we are almost lengthening our body. And then we have Jing, which is a gentle quietness. So this is a form of mindfulness and meditation. And truthfully, this is kind of the last concept we really hone in and focus on when we're teaching this, because in the beginning, we're really just learning, the foundational basics, like teach me the moves, period. And then we can kind of wrap back to these principles and put it all together and get better and better and better at it, so that it becomes a little bit more second nature and we can get into this state of Jing where we're finding some meditative quietness. All right. And then on to our stepwise progressive teaching method. So this is used in the Tai Chi for Health Institute teaching methods, I guess. But it's based on the theory that humans learn a new skill or art quicker and more effectively when one, the whole thing is broken down into pieces. The learning has structure and more than one of our senses is being engaged. So this has been tested in different fields of learning and validated by various different studies. Some of this actually aligns with like how we would teach adult learners even. So there's some different concepts there that kind of intertwine with how we're using the stepwise progressive teaching method. So this method goes through these 4 steps on your slide here. So one is watch me. So I would have participants stand in front of me or in Zoom, and I would tell them to just watch me. Don't follow along, just take it in, see kind of how everything works first. Then number 2 is follow me. So this is where I take them through the steps. So I break down like a form for them into different steps. And then I say, let's do it together. Let's play around with it. And then 3 is show me. So I want them to practice. And so I don't necessarily use the terms show me. I usually say go ahead and practice that, go play with that for a little bit because sometimes show me seems a little bit intense. But that gives them the opportunity to just play and figure it out in their own time. And while that's happening, I can still be doing the form in front of them, but I'm kind of watching to see where people maybe are getting hung up, to see where they're doing really great, and I can offer validation and clarity in places that we need. And so we'll bop between steps number 2 and number 3 a couple different times. Because when I mentioned earlier, the stepwise method, if I could talk, is really about breaking the whole down into pieces. So, for example, we do step 1 of the form. They follow me, we learn it, and then they practice. And then we're going to add on to that. We're going to do that step 1, and then we're going to add a step 2 to that. And then we'll practice. And we keep adding back onto those until we've gotten the whole form done, the whole move done. And then once we're done with that, we can practice the whole move together as a group. And just like the form, the movement, we keep building on the whole set. All right. And then last but not least for today, we have a little demonstration. So there's a lot of nuances when it comes to learning how to teach a class, and I know we're not going through all of it today, but you would do it. You would learn everything if you would want to become an instructor for these classes. But typically we would do a greeting. So this is kind of what our greeting looks like when we come together as a class. We would complete 10 different warm-ups. So, and we do them 3 different times. And each of these warm-ups focuses on warming up our neck, our shoulders, our spine, our hips, our knees, and our ankles. And so we go through each of those warm-ups and teach them how to do that as well. We would go through and either learn our new forms for the day, or we just go through the set and we focus on our principles. So going back to the beginning. And today I'm going to show you the Tai Chi for Energy set. And this is going to be the watch me step. So you get to just take it in today. So let me take a step back here and make sure I am all in the screen. And this is kind of what the setup would look like for my Zoom classes. And, we don't want to have super distracting backgrounds. We want to make sure we talk about even what to wear when we're talking about Tai Chi. And, some people prefer to wear athletic wear, jeans also work depending on kind of what people prefer to wear in your area. Um, and even if we're teaching, we get to wear kind of fun colored shoes so people can see exactly where our feet are moving. But let's go ahead and let me show you what our Tai Chi for energy set looks like. And I will give you prompts for each different form that I complete. Commencement, golden guard, open and close, single whip, waving hands, open and close, punch with covered fists, open and close, punch with covered fists, open and close, single whip to the other side, waving hands to the other side, open and close, and golden guard to the opposite side, open and close, and then closing. And that's the Tai Chi for energy set. So when we put all of it together like that, and we've never done Tai Chi before, it can look like a lot. But that's what we are doing here is help break that down and make it into easily digestible pieces that we can end up doing on our own at the end of the program. So that is a little bit of a look into Tai Chi for Health in Nebraska. We have a whole team of Tai Chi instructors here, and we are continuing to grow. But I wanted to open this up and see what questions that you all have for us.
Thanks so much. Oh, it looks like we have a hand raised. Go ahead.
Can you hear me okay?
Yes.
Yes.
Yeah, my name is Divya Saxena and I'm from North Dakota State University Extension. My question is about the survey evaluation tool you used, the health related quality of life, the pre and post evaluation survey. Can you please explain more about it, elaborate more about the items and measures it had? And I want to learn more about it. Thank you.
Yeah, that is a great question. I don't have it pulled up in front of me, so I can't give you like word for word what we have on there. And Julie, I don't know if you have access to it right off. But we do measurements on a scale of like 1 to 5, and we have them rate like how many days. Again, I don't have the exact words. Um, have you had more days than not that would have been bad physical health days or something? And I know it's not the exact words. And they would rate that on their scale. We have a mental health one. We have physical and mental health. We have a pain indicator. We have a sleep indicator. Um, we have personal health goals. And then we have some open-ended questions on there on the post survey so they can have a little bit of reflection, not only for themselves, but then we also are getting that qualitative data as well. If you would like to see specifics, we definitely can share out kind of what we're doing with you if that's of interest. So,
Yes, Brittany, I would be very interested, very much interested. Can you please share that with me?
yes. If you would
Thank you.
drop your email in the chat or reach out to me at my email, that would be great.
And Ashley from our team just shared the pre-survey in the
Oh,
chat
awesome.
box.
Thank you. I will include that in the follow-up email as well.
Thank you.
All right, there's a few questions in chat. How many hours was the training you completed?
It varies. It's usually at least a really big um day to 2 days, depending on what you're getting trained in. We did a Tai Chi for energy. It took us about a day to get trained with our master trainer. And then we did a little assessment with her to show that we can, we have the skills to teach that. And then, go ahead and pass that test so we can teach it here. So kind of depends, but usually it's about a day.
Awesome. Kevin asked if you have any YouTube training sessions recorded.
We can't do session recordings, as far as my understanding, just because the Tai Chi for Health Institute does have a trademark. So we'd have to be approved to do that. So what we've done is live sessions. And the other piece with that too is a liability thing. So we have to, even if we would do a Zoom session, we want their cameras on. We need to see that they're stepping safely. We don't want anybody to be injured on our time. So it is mostly live.
Okay. And then Taylor asked, how long is a single session class? And Julie answered 45 to 60 minutes. And then
Yes.
Natalie has her hand raised. Natalie?
Yeah, thank you. My name is Natalie Bachmeyer. I'm from Colorado State University. And I'm wondering, I have two questions actually. The first one is, have you all thought about doing any physical assessments, like looking at the physical changes from before and after the program? And then my second question is, um, what were you all thinking about and working with program sustainability? I feel like a lot of our exercise-based classes in Colorado, our participants just continue to want more. And similarly, they're 12 to 16 week programs. And how are you all thinking about like keeping folks engaged, even if you can't have facilitators directing programs year round?
Um, yeah, so it is a big commitment, Natalie. You know that very well. And so part of that is expanding the number of instructors that we do have here in Nebraska. And then secondly, part of that sustainability piece is also offering the Zoom offerings as well. So if we can't get there physically all the time, and as well as we do, that sometimes geographic limitations are there because we can't be in 6 different places at one time. So being able to rotate through that and then offer the Zoom pieces is kind of where we're thinking about that from that perspective. And remind me, what was your first question again?
Yeah, sorry about that. I'm on my phone. So, my
Okay.
first question was around physical assessments and if you all do any physical assessments. Yeah.
Yes. So we started off kind of, yes, the answer is yes. We've thought about it. And we started off, our colleague Ann Fenton, she is on today, but she was doing tugs assessments, if you're familiar with that, the timed up and go. And that measures how fast somebody can stand up, walk a certain distance, and then walk back. And we that had been used a couple times. We had kind of thrown around different, like, do we test blood pressure? Do we test some of those other things? But that also, we have to have the resources to do that. Sometimes we don't always have that. And so when we were thinking about consistency across the state, we kind of decided to gear toward the quality of life questions and how people were perceiving their health, rather than focusing on the physical assessment, at least at this time. And maybe it'll become more elaborate over time.
Just a very small follow-up question. How
Yeah.
has your Zoom participation been? Are people interested? Are you getting people from across the state? Like, there are barriers, I know, but yeah, how is that going for you all?
Yeah, I think we've had good feedback on it. We've had people from across the state have definitely joined. So that's been a great way to increase accessibility there. I would say that our attendance isn't as high as it would be in person. So that would be that's not entirely surprising, but it's also an option that's still available and we want to keep available.
Thank you.
Yeah, thanks for your questions.
Great. The next question in chat, Laura asks, is this exercise at beginner levels? My concern is seniors remembering all the steps.
Yes, so this is beginner level. And we have been in senior centers, we've been in assisted living centers. I think others have been in some nursing homes, and this is actually really, really great for our seniors, when we're thinking about mental memory health, dementia, Alzheimer's, all those things, because we're working their brain. And so we might go a little bit slower in teaching things with some of our senior, groups, depending on how everybody's doing, and really re-emphasize steps. But it's actually been really cool, to be in those communities. So it is very beginner friendly, and we can do a lot of adaptations for anybody that maybe has different abilities physically as well.
Great. And then Kevin asked if there was any other domains beyond sun and energy, and Ashley did answer that there are four different styles
Yes. Yeah.
offered. I had a question regarding how do you all go about recruiting participants? I know it can be kind of maybe hard to find people to commit to longer programs.
Yes. And that's something we've definitely kind of thought about. That is a barrier sometimes because we do end up having some people fall off as we go on with the class. I think that's a little bit unavoidable in some regards, but we do want to have buy-in. So we have, a registration fee, even if it's small, sometimes can be a motivator for people. We also want to create this small little community here in our Tai Chi classes, like, oh, I get to see so and so. And we do an activity where we go around and we just stretch our fingers and kind of get our bodies ready to warm up. And this is also an opportunity for people to go around and say hi, talk amongst themselves, sometimes a little bit of like a social minute or two. If we have a little bit more of a shy group, we can do an icebreaker and be like, hey, go around as we're stretching to talk. What's your favorite color? Tell people what your favorite color is. What's your favorite meal? Where did it come from? And when we build those connections, it has seemingly made it a little bit more exciting to come see friends, right? And that also kind of reinforces peer-to-peer learning as well. And so the more confidence we build within our group, the bigger community, the more successful I have noticed my programs to be.
And then how do you recruit participants from the beginning?
Yes, sorry, let me follow back up on that
Mm.
question. So recruiting from the beginning, um, everybody does a little bit something different across the state, but generally speaking, we're, posting in newspapers, posting social media. I personally have used the boost feature on like Facebook and Instagram, which has gotten some of the bigger statewide reach. Um, and a big one, just going and talking to facilities and being like, hey, is this something that would fit your needs? So whether it's a senior center or an assisted living center, they're usually pretty receptive. And then big one is word of mouth. So once you kind of get established and you've created an exciting program, people have been very positively responding to our offerings. So that's been an exciting thing to see as well.
Great. Thank you so
Michelle
much.
did ask in the chat if we facilitate solo or in teams. And when we're in person, we're usually solo. Unless we're close to another instructor and they want to join in. But on Zoom, we do have two instructors, one who is kind of taking lead of the class, and then one who is kind of sitting back and watching the participants, making sure nobody fell or they're all still responding, just for that safety piece.
All right, Danielle asked, are these free programs throughout the state?
We are charging, excuse me, a small fee. Usually it's been about $20 to $40 for the entire program.
Natalie asked if we needed any equipment, and Ashley answered there in the chat that we don't need any equipment other than a chair. Especially if you're doing the seated, obviously.
Are there any other questions or comments?
This is Anne. I'm going to make a comment. We do use a chair in class, especially for the older people, so that if they feel off balance, they can grab that chair, and it's a safety feature for us. We also like everybody to have a little bit of water, just because this is strenuous at some point. So those two pieces, there is a reason we have those pieces of equipment.
Thanks, Anne.
All right, well, while everyone's thinking of maybe any last questions or comments, I will just say that I will be sending out the slides along with links to the programs and this contact information so you all can follow up for more information. And then in chat, I did put a link to a feedback survey. It's really quick. We would super appreciate if you took that.
This is Natalie again. I have one more question. Sorry, I'm full
Yeah.
of them. Or maybe I missed this, are any of your team members like the master trainers? Are you going around and training other facilities and that's how you're expanding capacity?
That's a great question. So there's kind of three different levels. I'll give you the basis first. So we have instructor level, and then we have senior trainer level, and then we have master trainers. Nobody in Nebraska is currently a senior or master trainer. So we do have a connection with a master trainer who's absolutely lovely and super knowledgeable. That we utilize. And but we have been kind of floating around some opportunity for maybe expanding and getting a senior trainer or two here as well, not only to support our state instructors, but also kind of be the connector between the master trainer and then our instructors in general. So not only for our state, but also kind of the surrounding areas too.
Thank you.
Thank you all for being here today.
Danielle, I was wondering the same thing. Danielle asked, have you done this program in tandem with other holistic programs?
I have not. And I don't know that any of our other instructors in Nebraska have either. But when you think about 45 to 60 minutes, that gets to be a little bit long. So for the demographics and the people that we're working with, that is plenty. But doesn't mean that, there couldn't be some ideas there to, combine it with something else. We all have some other, we also have to think about like trademarks and stuff too with the program. There has to be some efficacy there. But I'm always open to being creative and finding solutions that kind of fit the group that we're working for. And now that I'm thinking about it, it could be a great alumni program where you run through Tai Chi set and then maybe you go into your your other program that maybe you had an idea for.
All right, I can stay on for a couple more minutes for any remaining questions or comments. But thank you all so much for being here today and for your engagement. Um, we hope to see you next month, and I hope everyone has a great rest of your Wednesday and a great rest of your week.
Thank you, everyone.
Thank you, everyone.
So
Okay, I think we just have Nebraska peeps left, Melanie. So
Okay, great.
Thank you, Anna and Ashley, for helping to answer questions.
You were great. Thank you. And Melanie, thank you for allowing us to do this. This was a great opportunity for us to help spread the good things we're doing.
Yeah, of course. Yeah, I was telling Brittany that I'm so glad that you all reached out, because it's for the past few years, it's kind of been up to me to find programs and projects and things that just come across my desk, and I would have probably not found you. We don't have too many. We've only had one other program from Nebraska, period, come present. So I'm so glad that you guys reached out. And also we haven't had programs for seniors or exercise, so it was great to showcase, another part of what extension can do. And you guys got some great engagement, so hopefully,
yeah,
there's some follow-up from this. So, as I said, I will be sending everything out. So Brittany or Julie, if you could send me the slides and then
mhm.
anything else you would want me to include, if people, want to engage or learn more.
Yeah, absolutely.
Okay.
Yeah, I only shared the pre-survey. There is a post-survey. It's not in the prettiest of formats like the other one was. So
True.
that's why I didn't want to put it in the chat. I could have
Okay.
saved it as a PDF, but it's not very pretty. I guess it's not very print ready um
Yeah.
as a PDF. So maybe we can work on getting that to download to a PDF. And then we can send you the post survey because there are a few different questions um on that post survey.
Okay, sounds good. Yes, thank you for reminding me that. I'm going to download that now. Okay, got it. All right. Well, thank you all.
Thanks, Melanie.
I'll be in
It's been
touch.
great.
you.
We will
Okay.
be in touch. Thank you.
Bye bye.
Bye bye.